Are you genetically susceptible to chronic pancreatitis? Imagine a puzzle where some pieces are inherited, shaping how your body responds to certain health challenges. That's often the case with chronic pancreatitis, a long-term inflammation of the pancreas. While lifestyle factors like heavy alcohol use and smoking are common triggers, genetics can also play a significant role in whether you develop this condition. Certain gene mutations can increase your risk, even if you don't have traditional risk factors. For example, mutations in the PRSS1 gene are well known for causing hereditary pancreatitis. This gene makes a protein called trypsinogen, which helps digest food. When mutations occur here, they can cause the enzyme to activate too early or resist breakdown, leading to damage in the pancreas tissue. This inherited form of pancreatitis often begins in childhood or adolescence and raises the risk of developing chronic pancreatitis and even pancreatic cancer later on. Another important gene is SPINK1, which produces a protein that normally inhibits trypsin activity to prevent damage. Mutations in SPINK1 can weaken this protective effect, making the pancreas more vulnerable to inflammation. The CFTR gene, famous for its role in cystic fibrosis, also influences pancreatic health. Mutations here can disrupt pancreatic secretions and duct function, increasing the chance of inflammation. Variants in other genes like CTRC and CASR also contribute to susceptibility by affecting enzyme regulation and calcium sensing within the pancreas. It's important to understand that most people with chronic pancreatitis don't have just one gene mutation. Instead, they often carry multiple genetic variants that interact with environmental factors like alcohol, smoking, or diet. This complex interplay means that genetics can increase your likelihood of developing the disease but don't guarantee it will happen. Genetic testing can help identify these mutations, especially if there's a family history of pancreatic issues. Knowing your genetic profile can aid in early diagnosis, guide lifestyle changes, and help tailor treatment strategies. It can also provide insight into your risk of pancreatic cancer, which is higher in those with hereditary pancreatitis. Remember, genetics is just one piece of the puzzle. Environmental factors and overall health also influence disease development. If you're concerned about your risk, consulting a healthcare professional or a genetic counselor is a good step. They can help interpret test results and recommend appropriate monitoring or preventive measures. In summary, yes, you can be genetically susceptible to chronic pancreatitis due to inherited mutations in key genes involved in pancreatic enzyme regulation. But it's a multifaceted condition where genetics and environment work together. Being aware of your genetic risk allows for closer observation and early intervention, which can make a meaningful difference in managing your pancreatic health and reducing the risk of complications like pancreatic cancer. Always seek personalized medical advice to understand your unique situation fully.